Stopping of breath in sleep. In medical terminology, this is called sleep apnea. Why does this happen? How can you fix it? I will talk about this in today's video. People suffering from sleep apnea either develop diabetes. Those people who have sugar or are pre-diabetic, sugar has not been there, can be. The risk is higher. Blood sugar level always stays high, but not so high that they are classified as diabetics, and these increase the blood sugar in the body by reducing the vitamin B1. Due to the deficiency of vitamin B, the lower part of the brain could be affected. It is the brain stem that regulates our breathing process, controls breathing, blood pressure, heart rate, and digestive system. The muscles around the alveoli that contract and pass when breathing. First, the diaphragm and intercostal muscles bring signals to this, and we are able to breathe. Our heartbeat is under its control. Body balance and some other things are also included in this. It happens in such a way that a nerve comes out from it, a vein comes out. This is called the phrenic nerve. Beware, chest on the top. Breathing becomes possible due to the inflation and spread of the lungs, which allow air to enter, or it affects the breathing center function. The function of the phrenic nerve gets damaged, and this signal from the brain reaches the diaphragm, in which sleep apnea or persistent hiccups or sudden stop of breath are included. See, when we are not conscious in sleep, they contribute to inherent bonuses. It's part of our nervous system. We can light our breath ourselves. It can restore breath, but in sleep, everything goes into automatic mode. The autonomic nervous system controls it and the brainstem controls it. The lack of B1 not only affects the function of the brainstem, lactic acidosis also develops where lactic acid increases in the blood and there is a lack of oxygen. The blood pH goes down, causing difficulty in maintaining discipline or breathing. And if you don't look at it, it's one. The disease can progress to a condition called beriberi, which can then be reversed. It is possible, but it gets a little difficult in children in sudden infant death syndrome, where a child of 6 months suddenly stops breathing in sleep. It also happens. Where vitamin B1 deficiency transfers in children for months. Due to this, the function of the breathing center is disturbed, and this becomes a reason for sudden death. If you are a victim of this, work on your vitamin B1. Show on this bean intake. If sugar is too big, then control it. If weight is big, then reduce it, because it has extra fat, especially on the throat and neck, which makes it difficult for air to pass through the respiratory tract. This also becomes a reason for ear obstruction. It pushes it away. Sleep on the side straight if you sleep. Then the soft tissues in the tongue and throat prod this. They collapse due to weakness, stopping the path of air, which leads to a halt in breathing. Regular physical activities tone up the smooth muscles, which includes the muscles of the throat. Excess weight can be reduced through exercise. And then what if it's glut? Then yogurt is a good source of vitamin B1 in the diet. Oh, what's up? Now this is the talk about lots of peas. If you cover them and found vitamin B1, then after that in the winters the air becomes dry, which stops the respiration process. So these also come in handy. Thanks for stopping by my channel. Take care. Goodbye.